Good afternoon. My name is Kendra White, and I'm the Senior Manager of Community Relations for UPMC for Life. You're joining us today for the Staying in Touch series, Episode 8, Finding Strength, Recovery, and Resources. The Staying in Touch series was designed with you in mind. UPMC Health Plan is here to help you stay connected and informed during this challenging time. We are so happy that you have taken the time out of your day to join us to hear from some of our experts in the fields of preventive medicine, mental and physical health, and other specialties about how to stay healthy, manage stress, be active, and connect with your community, all from the comfort of your home. Our program will last about 30 to 45 minutes today. And before I introduce today's presenters, I want to start with a quick poll question for our audience of listeners. So if you're listening on the phone, you can press 1 for yes and 2 for no. If you're joining us via the online platform, you will see a new poll question that has become available. You'll have the option to vote accordingly. So my question today, before our presentation, I am knowledgeable about how to get connected to programs and resources that can help myself or a family member cut back on alcohol or other substance use. Press 1 for yes or 2 for no. Again, I am knowledgeable about how to get connected to programs and resources that can help myself or a family member cut back on alcohol or other substance use. I also would like our audience to know that if at any time you would like to ask a question for our presenters, you can press star 3 on your telephone keypad to be connected to someone from our team who will take your question and share with us. If you're joining us via the online forum and decide to type in a question there, please provide us your name and an email address or phone number where we can get back to you, as that information is not provided automatically in the forum. So again, that's star 3 to ask a question from your telephone, and on the online forum, just provide us some contact information. If we do not get to answer your question on the live call today, we will be given a log of questions after the call that will enable our team of professionals to follow up with your question, comment, or need accordingly. If you have questions specific to the COVID-19 virus, we ask that you visit our website at www.upmchealthplan.com/COVID-19. So one more time, that's star 3 if you're joining via the phone today and have a question or comment. We also would welcome any ideas that you may have for future topics. These programs are created with you in mind, so we certainly welcome your feedback on future topics. And without further ado, I want to introduce today's presenters. We have Dr. Cara Renzelli. She is the Clinical Director of Substance Use Services, Behavioral Integration for UPMC Health Plan. She joined the health plan in March of this year, bringing with her 10 years of research experience and 15 years in leadership roles in research, clinical training, and business operations at a Western Pennsylvania-based treatment provider for substance use disorders. Dr. Renzelli's interests are in implementing and sustaining science-based treatments, overdose awareness and prevention, and population health management. Also joining me today is Dr. Jody Glance. Dr. Glance is an assistant professor of psychiatry at the University of Pittsburgh School of Medicine. She is the medical director of addiction medicine services at Western Psychiatric Hospital and is a fellow of the American Society of Addiction Medicine. She also serves as the associate director of medical student education for the Department of Psychiatry and is an advisor and co-founder of the Women's Mental Health Area of Concentration. Dr. Glance mentors medical students and residents in the treatment of individuals with co-occurring psychiatric and substance use disorders. Thank you, ladies, so much for joining us today. We appreciate your time.
Thanks, Kendra, for the introduction, and thanks so much, Dr. Glance, for co-presenting today. I also want to say you to all of our attendees for joining us and for making your health and well-being and the health and well-being of those you care about a priority. So there are 6 main points that we want to discuss today. They are: 1, possible reasons for using alcohol or other substances. 2, we want to talk about how heavy use affects your health. 3, we want to look at withdrawal once using substances stops. We want to talk about how to stay strong and healthy, how to get help, take a look at some additional resources, and we want to save some time at the end for questions. So let's talk about how to stay healthy, active, and connected against the backdrop of COVID-19 and social distancing, which has now become such a routine part of our lives. And I venture to say that roughly 3 months ago, most of us hadn't heard of that term, or if we had, we really hadn't given it much thought. I was thinking the other day that, quick trips to the grocery store just don't exist now. I have to make sure that I wear my mask, and then I'm paying attention to the direction that I move up and down the aisles. And when I'm in the aisle with someone else, I need to make sure that I'm keeping distance between that person and me. So in that respect, even though it feels a little frustrating at times, I know that I have an obligation to help others stay healthy, as well as looking after my own health and safety. So this idea of social distancing has its upsides for sure, but there are also some downsides. It may lead to feeling bored, lonely, depressed. If you are used to being around people all the time, you may feel like something important is missing in your life. If you like to, for example, engage in small talk with others, meet for coffee with folks, go to the gym, or some other activity that keeps you really connected to people, you may now be experiencing a disconnect, which isn't a real positive feeling or a comfortable state for a lot of people. So one of the big consequences here is that we could have the potential to drink too much alcohol or misuse substances as a way to cope with these uncomfortable feelings. So let's take a look at alcohol as an example. I think most of us would agree that consuming alcohol is usually pretty accepted in American society. People like to drink for various reasons, and those reasons include, fun, socialization, celebration. For example, birthday parties, going to meet up with friends for happy hour. Warm weather is coming, so we'll be wanting to go to cookouts, outdoor sporting events. There are also some cultural beliefs, family traditions around alcohol use, so drinking around the holidays, celebrating at weddings. People drink also for enjoyment. People enjoy the taste of alcohol. There is sometimes, what I consider to be kind of a culinary appeal, pairing, for example, food and wine. People drink for relaxation. People drink for stress relief. So, there are also medications that we want to touch on that are used to manage certain conditions. For example, medications are used to treat depression or anxiety. Those work well when used as prescribed. Another example is that opioids are often used for pain, chronic pain from injury. But what is really important to note here is that medications are good when taken as prescribed. So we'll now turn the next part of the presentation over to Dr. Glance, who will talk in more detail about health.
Thank you, Dr. Renzelli, and thank you all for tuning in today. Just to talk a little bit about the health effects of alcohol. And I just want to say alcohol in and of itself is not bad. We're not here to say, alcohol is a terrible thing and everyone should avoid it. Alcohol, it just is. And as Dr. Renzelli mentioned, it's a part of It's a part of many of our lives, socially, in celebrations. And so it's not that it's necessarily bad. It's just that if we drink too much, it can really have an impact on our health. So what can happen? Well, I think most people know that it can impact the liver, excuse me, and it can lead to liver disease. And you think of like the cirrhosis and some of the things that might happen for people who are drinking really a lot of alcohol. But it's also, it can impair your liver function just to the degree that it can cause metabolic problems. You can be at increased risk for things like diabetes. There's a lot of sugar in lots of kinds of alcohol. So it's not just the really chronic heavy use that can lead to problems. Also, it can impact your cardiovascular system, your heart, your blood vessels. It can cause problems with high blood pressure. It can impact your brain and help cause problems with memory, cause problems with being able to pay attention, being able to focus. And I think right now with COVID-19, a lot of us are having a different kind of life where we are having trouble focusing because everything's off. Everything's off with our schedules, maybe with our sleeping patterns. And so alcohol can make that worse too. And also it can increase the risk of injury. So if you're home alone and you don't have anyone else there and you are intoxicated and you fall, you might have a serious injury, but then you can't find a way to get a hold of someone to help. So these are potential problems. And also tolerance can happen where you're drinking more and maybe it's kind of creeping up on you and you don't realize that you're needing more and more of alcohol or whatever substance it is to get the same effect. And then conversely, if you stop drinking, you might experience withdrawal. And I want to talk a little bit about what withdrawal is and help you understand when you might want to get help for that. So withdrawal is when you have physical symptoms or mental symptoms that happen after you stop using or decrease the amount that you're using of a substance. It can be mild, moderate, or severe. So most is mild to moderate. About 80% do just fall under the mild to moderate category and don't meet the criteria for severe. And usually with mild to moderate, people don't need to seek medical attention. So this can be things like feeling very anxious after you've stopped drinking, feeling tremulous, shaky, not being able to sleep well, insomnia. Moderate would be a little bit more than that, where you might find yourself feeling like you're sweating and your heart's beating really quickly, maybe some nausea, maybe even some fevers. If you're getting to that point, you are going to want to start thinking about, do I need to get some help with this? And severe would be if you're feeling confused, if you're very irritable or agitated, if you're having any kinds of seizures or hallucinations. Obviously, this is very important that you will want to get help. And I want to say, too, that if you've had any history of seizures, if you have a seizure disorder or you've ever experienced a seizure, whether it was related to withdrawal or not, don't try to go it alone. Don't try to kind of white-knuckle your way through it. Please do seek help, and we'll give you some resources on where to find help. Next slide. And, it is very difficult to predict who will have severe withdrawal and who won't. So if you know that in the past you've had severe withdrawal, that is a good predictor that it could be severe again. But a lot of times, we don't know. We haven't had that experience, so we're not sure. So I mentioned already about previous withdrawal or history of seizures. Also, if you've had any history of DTs, delirium tremens, this is that real severe agitation, confusion, sometimes hallucinations. That's a risk factor. If you have a history of blacking out while you've been drinking or intoxicated where you can't remember certain events that happened while you were under the influence, that's a risk factor too. And then I want to bring up, if you're taking medications, prescription medications for things like anxiety, insomnia, any of the benzodiazepines, these medications, along with opiate medications too, if you're taking them in combination with alcohol, that can be a significant risk factor for a worse course of withdrawal. And then if you have any pre-existing other medical conditions or illness, again, please don't try to go it alone. Reach out for help so that you can get a proper evaluation and help with getting through when you're trying to stop drinking or decrease. And then back to Dr. Renzelli to talk a little bit more about some resources.
Great, thanks. If you think that you or a loved one may be struggling, it's important to note that the majority of treatment facilities are accepting new patients right now. You can give them a call. They can complete an assessment and make a recommendation for an appropriate course of treatment. A lot of counseling is being done right now, tele. So it's being done either via video or, like in the case of the assessment that I mentioned, a lot of it can be done over the phone. If you want to seek support on your own, 12-step programs are usually a great place to start. Alcoholics Anonymous, known as AA, Narcotics Anonymous, known as NA, both of those have online meetings that are happening. So let me share with you just two web addresses, and I know that some folks can see our slides, some folks are joining by phone, so I'll take a moment to spell out each of these websites for you. So a good one to start is with AA, and it's aaintergroup.org. So it's aa-intergroup.org. And for NA, there's virtualna.org, and it's virtual-na.org. Now, if you're interested in non-12-step support, check out Smart Recovery. That's smartrecovery.org, smartrecovery.org, all one word, Smart Recovery. And if you are a family member of someone who's struggling, there are also a lot of resources available for family support, including Bridge to Hope. If you are local to the Pittsburgh area, Bridge to Hope has several sites around the city here. There's also Families Anonymous, and you can contact them at familiesanonymous.org, FAMILIANONYMOUS.org. And if you're interested in mobile apps, you can go to an app store, search recovery tools, and you'll find a lot of different choices. I completed a quick search yesterday, and just generically searching recovery tools, over 50 of them popped up for me right away. So a lot of options there if you like to connect through apps. And moving on to the next slide, so we came up with some steps to help you stay healthy and strong. First, we recommend that you communicate with others. If you are in recovery, stay connected to your support group by calling, texting, video chatting. Check-ins are more important than ever. Keep that connection going with others. Exercise is another great recommendation to stay healthy and strong. We like to say, move your body to change your mind. Exercise reduces stress, it helps to beat boredom, and you get a lot of health benefits from it. It's a mind-boosting activity. And you don't need to have gym equipment at home to get a good exercise in. Think about stretching, yoga. We have heard, you can do light weightlifting using household items like soup cans or whatever you feel comfortable with. I know sometimes the toughest part is just getting up and getting yourself moving, but I promise you, once you do that for 5 minutes, you'll feel so great that you even got started with it. And the other activity is start a new hobby. We've probably all had things kind of on our mental to-do list that we just haven't had time to try, and now is the time. The challenge of trying something new breaks up monotony. It keeps us focused on that task, and it can really be just a lot of fun. So next slide. And before we move to answering questions, We just want to note that there are some specific UPMC resources available to you. I will now turn this back over to Kendra to walk us through kind of the closing and move into our questions.
Great. Thank you both so much. This was a very informative topic, and I do see some questions that we can get to. But before that, I wanted to remind our listeners, if they have a question or a comment, you can certainly connect with someone from our team by pressing *3 on your phone, or you can give us a call at UPMC Health Plan. We can provide you with resources and help that you need. We have a website that's set up for our Staying in Touch series. You can also find previous talks embedded there, as well as the slides. They are available as well, and that's upmchealthplan.com/in-touch. That's upmchealthplan.com/in-touch. And for information about COVID-19, that website is available also, and it's upmchealthplan.com/COVID-19. I do have one final poll question that I would like to ask our listeners. After hearing today's presentation, I am more knowledgeable about how to connect with programs and resources that can help me or my family cut back on alcohol or other substance use. Press 1 for yes or 2 for no. Again, after hearing today's presentation, I am more knowledgeable about how to connect with programs and resources that can help me or my family cut back on alcohol or other substance use. I want to see if those numbers go up. It was such a great talk. And our first poll that gave us 64% said yes. They felt comfortable that they had some knowledge to be able to get help or resources for themselves or a family member to be able to try to cut back on alcohol or other substance abuse. And Dr. Renzelli, if you could take a minute and maybe just recap a few of those websites. There were some questions that, could we repeat the link for NA? So maybe if you could just go through some of those again one more time.
Sure. So the link for AA is aa-intergroup.org. And I'll spell it out. aa-intergroup.org. aa-intergroup.org. For NA, we have virtualna.org. V is in Victor, IRTUAL-NA.org, virtualna.org. And when you go to these websites, they will give you long lists of online meetings that you can attend. Some of them will show the areas where these meetings are hosted. So you could join a meeting in Tempe, Arizona, if you wanted to. Both of those sites are really great resources. So AA Intergroup and virtualna.org on both of those. For non-12-step support, you can check out Smart Recovery at smartrecovery.org. It's one word, SMARTRECOV, as in Victor, ERY. Some of the resources that are available for family support include Bridge to Hope. If you are in the Western Pennsylvania area, you can Google them, and the website will direct you to different activities that they have going on. And Families Anonymous at familiesanonymous.org, FAMILIESANONYMOUS, familiesanonymous.org. There are also other supports available online. Those are just, one of each area that we wanted to direct you to as a resource. There is Al-Anon, Nar-Anon, and if you just do a quick Google search, those will come up for you. And again, you'll be able to see if there are any virtual web-based events happening that you can join, usually just by clicking a link, and that will take you right in.
Thank you very much. I think, it's a lot to listen to over the phone. If you're joining us on the online forum, you're able to see the slides, but on the phone, it's helpful to repeat some of that because I think a lot of the comments that I'm seeing is looking for support, folks looking for support if they live with an alcoholic. And there are a lot of family programs out there as well. And I personally haven't looked at a lot of any of the mobile apps that you mentioned or that you said were available. But do those typically connect folks with, some live support or somebody that they can call typically as well?
Yeah, most of them do have phone numbers that people can call to connect with someone. Some do have different chat functions and so on. You'd have to go through and look at the functionality of each one to decide if it's something that you'd want to download and engage in. But like I said, there are a lot of them available. If it is something that appeals to you, by all means, and many of them are free. By all means, it never hurts to download it and play with it and see if it does benefit you, suit your needs, again based on the functionality of it. But there are numerous ones out there that my research said could be helpful.
Excellent. Thank you very much.
You're welcome.
Do either of you have any final comments or anything you want to say before we wrap up today?
Dr. Glance, anything? I have something that I'll say in closing, but go ahead.
Yes, this is Dr. Glance, and I just wanted to say that I do appreciate that many of you also may be tuning in because you're maybe not worried about yourself, but you're worried about someone that lives with you or a loved one who maybe you don't have contact with because of social distancing right now. So it can be tricky to know how to intervene. And so sometimes seeking out these supports that we've mentioned here, doing some research on your own, checking them out will be helpful because you can kind of see what's out there, what's available, so that when and if you do decide to approach your loved one, you have a sense of what is available, so that if there is a window of opportunity where they're interested in getting help, you'll be ready to answer some of their questions and have those resources available.
I think that's a great comment. Particularly the topic is very sensitive, and we just want our listeners to know that there are resources out there. You are not alone, and we're here to help and try to provide or link you with any types of resources that we can to ensure that you get some help for yourself or your loved one, particularly during this time of social isolation and staying at home. And Dr. Renzelli, did you have any final comments as well?
Yeah, a couple of things. I want to echo what Kendra and Dr. Glance said. Oftentimes making that first outreach is the toughest but most important part of this puzzle, right? So just keep in mind that no matter what, positive change is always possible, and potentially taking that first step to reach out to talk with someone is really the first step that we all have to take for better health. So even though you may hesitate to do that, know that there are people out there who want to be helpful to you. I also saw a question pop up about stats around substance use during COVID. I know that is being well tracked. Anecdotally, we are hearing that there are some increases out there in overdose rates. Now, when we say overdose, we usually think about in terms of opioid use, but also, given our presentation, think about in terms of all substances, including alcohol. This time of COVID is an increased time of danger because people tend to be drinking and using other substances alone. So I would encourage everyone to talk a lot about that, about the fact that people are continuing to drink and use other substances, and that really increases the risk of danger because we are really practicing, kind of distancing and isolation.
Great, thank you. And I do want to comment, our polls wrapping up, and it looks like 91% now feel they are more knowledgeable after listening to today's presentation. So that's great job, ladies. And I wanted to, in closing, thank you both again for joining us. And I want to promote our upcoming episode, which will be next Tuesday at noon. So it'll be Tuesday the 19th at noon. And we will talk about resources in your community. We'll have Dan LaValle, Social Impact Director at UPMC Health Plan, and Cinda Watkins, Human Services Senior Manager for the United Way. And they will talk about how this challenging time has impacted our community. They'll also discuss 211, a 24-hour service that can help you with utilities, food, housing, and transportation. And Shannon Miller from our Resources for Life program will cover how UPMC Health Plan can connect members to many additional resources for caregiving, childcare, medication cost assistance, home improvement, and more. So we look forward to that next Tuesday. And again, thank you for joining us today, and we appreciate your time. Have a great afternoon.